you want to know what it means to be maxed out on vasopressors or inotropes when your loved one is critically ill in intensive care, stay tuned. I have news for you. So one of the questions that we get quite frequently is, what does it mean when my critically ill loved one is maxed out on vasopressors or inotropes? And that is a very important question if you are faced with that situation in intensive care, because it is absolutely life or death when that happens. So let's explain that to you now. By the way, my name is Patrick Hutzel from intensivecare.com, and this is another quick tip for families in intensive care. So let's get right into it. Maxed out on vasopressors on inotropes typically refers to a clinical situation where a patient requires the maximum dosage of medication that are either increase blood pressure, vasopressors, or support heart function, inotropes, to maintain hemodynamic stability. Here's a brief explanation of both categories. Vasopressors, these are medications used to constrict blood vessels and raise blood pressure in cases of hypotension, which is low blood pressure, such as in septic shock, cardiogenic shock, or other forms of shock. Common vasopressors include norepinephrine, also known as noradrenaline, epinephrine, also known as adrenaline, dopamine, phenylephrine. Inotropes, these are medications that increase the strength of the heart's contractions, used in cases of heart failure, low cardiac output, or cardiogenic shock. Common inotropes include dobutamine, milrinone, dopamine, and another vasopressor that wasn't mentioned actually is vasopressin. So when a patient that's critically ill in intensive care is quote unquote maxed out on these medications, it means they are receiving the highest allowable or effective doses, but they may still not be achieving optimal hemodynamic goals, i.e. maintaining blood pressure, cardiac output, or vital organ perfusion. This could indicate a severe underlying issue such as refractory shock, severe heart failure, or other critical conditions. At this point in time, the medical team may consider advanced therapies such as intra-aortic balloon pumps, also known as IABP, to support the heart, ventricular assist devices, or ECMO, also known as extracorporeal membrane oxygenation. Next, re-evaluation of diagnosis to determine if the treatment approach needs modification or if there's a reversible cause for the shock. And lastly, consulting specialists for additional expertise in critical care, cardiology, or other relevant fields of expertise. So the other thing that is important to know here, is when someone is quote unquote maxed out on inotropes or vasopressors, they are often considered end of life. And other signs you will see is when you do an arterial blood gas, for example, or check blood results, lactate is often very high, right? Urine output often drops if, sometimes it stops completely. And other symptoms you will see is that ventilation requirements are going up, FiO2 might be going up, someone might stop breathing completely, and a patient might become acidotic as well. So I hope that explains to you. I mean, if you are in a situation like that, I would encourage you to reach out to us as a matter of urgency here at intensivecare.com, and you can call us on one of the numbers on the top of our website, or you can simply send us an email to support@intensivecare.com. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecare.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that on our testimonial section at intensivecare.com, and you can verify it on our intensivecare.com podcast, where we've done client interviews. And we have helped hundreds and hundreds of members and clients over the years to improve their lives instantly when they have a loved one critically ill in intensive care, But like I said, we have also saved many, many lives when they had loved ones in intensive care in what I refer to as perceived end-of-life situations. And we turned many situations around with our consulting and advocacy and with our insights that we have into intensive care and into critical care, because we are industry insiders. And I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. I also talk to doctors and nurses directly if you want me to, and I talk to them on your behalf, or I talk to them with you, and I ask all the questions that you have not considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecare.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecare.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecare.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivecare.com, and I will talk to you in a few days. Take care for now.